Hi, so I'm Rizwan Malik. I'm a radiologist here at the Royal Bolton Hospital, and today we're discussing some of the changes we've done with technology and our introduction of artificial intelligence. COVID-19 itself has brought with it some unprecedented challenges that meant we've had to do things differently within the NHS. This is including the use of technology to enable us to work more safely and efficiently across the entire sector. Here at Bolton, we've been interested in using artificial intelligence for quite some time now, but due to the COVID pandemic, we've had to accelerate how we do things to enable support for medical diagnosis and treatment for our patients. And in particular, we've enabled the use of AI in radiography. Radiology has emerged as a key focus in the fight against COVID because predominantly this is a disease which affects the lungs. X-rays can help us diagnose the disease and also tell us whether things are getting better or worse. This is where the AI technology comes in. The algorithm looks at the chest X-ray, identifies the changes within it, and then describes whether or not the pattern of disease is consistent with COVID or not. It can also pick up other conditions such as different types of infections or, for example, masses, which might be cancer. It puts all these together and gives us an output and categorizes whether the risk for COVID is none, medium, high, or indeed low, and also what percentage of the lung is involved. This gives doctors, right at the time of scanning, a very quick interpretation of whether the changes are likely to relate to COVID, so that these results can be used to enable them to make some very quick decisions about the appropriate treatment for their patients. This, for example, might mean whether or not they need to be escalated to use critical care beds. And as we've seen from other countries around the world, for example in Italy and Spain, this is a very finite resource which we need to manage carefully, and it's very important in the management of deteriorating COVID patients. For example, the patient may need to be put on CPAP treatment, which is where you have to wear a mask with the hose you may have seen, which involves a steady stream of high pressure oxygen, or indeed, if they get worse still, to take them to ITU for potential ventilation. Clearly, if the condition gets better, because we want to manage these resources as efficiently as possible, we need to know when it's safe to step our patients down from ICU or indeed from the critical care environment. And it can also tell us these improvements as well. In this regard, it's not a decision-making tool, but we're using it as clinical decision support to give our doctors yet another tool to make fast, evidence-based decisions in the care of our patients. So in this regard, we like to think of it as a valuable member of our team, as something we really need when tackling this global pandemic.